What if I told you that the moment you walk into a doctor's office, a silent countdown begins? Not for your appointment time, but for how seriously you'll be taken based on nothing more than the number on your birth certificate. After spending months interviewing hundreds of healthcare workers, nurses, and retired physicians, I've uncovered a disturbing pattern of medical ageism that's hiding in plain sight, costing seniors proper diagnoses, adequate treatment, and in some cases, their lives. One retired cardiologist speaking on condition of anonymity called it the healthcare industry's worst-kept secret, a systematic bias so ingrained that most medical professionals don't even realize they're doing it. From the shocking mental shortcuts doctors make the instant they see your age, to the economic calculations happening behind closed doors during your treatment decisions, what I'm about to reveal will fundamentally change how you view every medical interaction you'll ever have. But here's what makes this exposé different. I'm not just going to show you the 4 brutal realities that are undermining your healthcare. I'm going to arm you with the exact strategies that savvy seniors use to flip these dynamics completely and command the premium care you deserve. If you've ever felt dismissed, rushed, or patronized by a medical professional, what you learn in the next few minutes could literally save your life. This video will give you a whole new perspective on your life. Make sure you don't miss the final part, because that's where we reveal the shocking truth behind one of the most disturbing questions in modern healthcare. Why are seniors' lives considered less valuable? The answer may completely change how you see aging and how you demand to be treated. Let's start with the first ugly truth that happens within seconds of your doctor seeing your chart. Before they ever talk to you, healthcare practitioners put you in a mental box as expensive and complicated. The information in this video is for educational purposes only, compiled from open sources, and does not substitute medical advice. Please consult your doctor for any health-related concerns. As soon as you walk into a doctor's office, your age triggers an immediate mental evaluation in your doctor's brain. Medical personnel are trained to assess resource needs, and older persons are promptly put in the group that needs the most help. This act isn't meant to hurt anybody. Your entrenched programming affects every interaction you have. Dr. Sarah Henderson, a former ER doctor who now fights for the rights of older patients, brought this disturbing reality to light. Medical education provides rules for how to be efficient that essentially group patients by age ahead of time. Older patients will probably require longer visits, more tests, and more complicated prescription management. This creates bias in the mind even before the physical test begins. The financial burden greatly exacerbates this bias. When doctors care for older people, they are under a lot of financial strain since their insurance payouts are going down and their patient loads are going up. Their limited schedules can make it hard for them to meet all of your health needs. This stress causes a kind of anger that might affect the quality of care you receive. Studies show that doctors spend around 23% less time really listening to people over 65 than to younger patients with the same complaints. For example, Maxine, a 74-year-old retired librarian, had something happen to her. She came to her appointment with a long list of symptoms that she had been keeping track of for a few weeks. But before she could finish her opening remark, the doctor cut her off and said, "Let's focus on your main issue today." When Maxine tried to explain how her ailments were related, the doctor just sighed and said, "We need to set priorities." Her chest pain was written off as anxiety, which delayed her heart problem diagnosis by 6 months. This aversion to complexity goes beyond just managing time well. Doctors often don't ask for extensive tests for older people since they think the results would show a lot of illnesses that need different kinds of therapy. They would rather deal with visible symptoms than do a full investigation that might reveal widespread health concerns. This method has a big influence on the mind. When medical personnel come to you with preconceived ideas about how hard and expensive treatment will be, they are less likely to work with you to come up with treatment plans that work for both of you. Instead of looking closely at your specific situation, they usually use conventional methods that are meant for prevalent health problems in older adults. Here's what you should do right now to fight this bias. At the start of each appointment, be sure to explicitly state your particular, measurable health goals. Instead of just saying, "I'm tired," try saying, "My energy has dropped by 40% in the last 3 months, and I need to figure out what's going on." This changes how they see you from a tough elderly patient to someone who is focused on getting results. Make a short one-page health summary that shows how far you've come with prior treatments. This shows that you are actively taking care of your health instead of just accepting whatever treatments are supplied. Doctors really like dealing with patients that they see as partners instead than problems. When talking about your health problems, don't forget to ask for specific time periods. You may remark, "Doctor, I know we don't have much time today. Could we set up a 30-minute meeting next week to talk more about my cardiac problems?" This method shows that you care about their availability while also making sure you get the right medical care. One of the most detrimental ideas about old healthcare is that mental sharpness always becomes worse with age. Medical personnel sometimes oversimplify treatment conversations, avoid complex therapeutic options, and make healthcare decisions based on age-related IQ stereotypes rather than assessing each individual on their own merits. Dr. Amanda Richardson, a neuropsychologist studying medical bias, reveals this disturbing reality. Healthcare staff often don't give enough credit to the mental capacity of those over 65. They typically recommend simpler, less effective therapies because they think elderly people can't handle complex medical regimens. This sets up a harmful cycle in which older patients get worse treatment because of false ideas about their mental capacities. The effects go well beyond hurt feelings. When doctors assume you can't understand complicated treatments, they don't provide you sophisticated therapies, specific treatment options, or rigorous diagnostic methods. Instead, they use simple methods that don't need much from the patient or understanding. For example, Louise, who is 71 years old and used to be a chemistry teacher. Her doctor immediately proposed a simple mastectomy when she was diagnosed with early-stage breast cancer. He didn't talk about reconstructive options, targeted therapies, or research trials. He said, "Given your age, we prefer keeping things simple," to explain why he made this decision. Louise fought for months to get the same treatment options that younger women with the same illnesses were getting. This mental bias shows itself in subtle ways. Doctors speak more slowly, use simpler words, and give elderly patients overly simple explanations, no matter how smart or educated they are. The prejudice in managing medications is quite dangerous. Healthcare staff often choose less potent medications with easier dose regimens, assuming that elderly patients are unable to manage complex prescription schedules. Bias in technology makes things worse. Doctors think that elderly people can't use health monitoring apps, electronic medical systems, or digital communication tools. This misconception keeps you from using modern healthcare tools that might help your treatment and communication with your physician. When older people believe these expectations, the self-fulfilling prophecy becomes quite bad. After having to deal with simple conversations and watered-down treatment options over and over again, some older folks tend to think they can't understand complicated medical information, which makes them dependent on it when they didn't need to be previously. Here is how to quickly shatter these ideas. When you talk to a doctor, always start by talking about your schooling, work experience, or other talents that could be useful. You may say, "I've worked on complicated projects for 30 years, so please give me the detailed medical information I need to make a good choice." Ask for technical explanations in real medical jargon. Ask your doctor to explain the pathophysiology of your ailment and how each medication works to fix the underlying problems. This shows that you are eager and able to absorb complex medical information. Bring evidence of your mental talents, such research papers about your disease, questions you made up from medical journals, or notes from other experts. This hard proof of your engagement very much makes them give up their ideas. When you get simple recommendations, ask them straight. "If I were 45 and had the same problem, what more therapies would you suggest? I want to know all the possibilities, no matter how hard they are." Use technology when you visit. You can use your phone to look up prescription interactions, use health apps, or check digital medical records right in the office. When physicians see that you are comfortable with technology, it definitely makes them question what they think about older people's skills. Finally, ask for detailed written plans for therapy and information on the medications. Say, "I need full records of my treatment options so I can look over and think about each one carefully." This makes it evident that you want to be an active, knowledgeable participant in your healthcare choices. Write down everything that happens throughout your medical appointments. Doctors can tell when you're taking notes and know that you're paying attention, which usually helps them remember crucial things. This kind of supervision really changes how they act and talk to you. They use what may be called polite medical gaslighting to make your worries seem like a normal part of becoming older. Sadly, medical gaslighting aimed at elderly people has grown so common that healthcare workers sometimes don't even aware they're doing it. When doctors say that real symptoms are just a part of getting older, they are using a socially acceptable type of prejudice that makes it harder to get the right diagnosis and treatment. Dr. Michael Torres, an expert in caring for the elderly who has spent his whole career fighting ageism in healthcare, says it this way: the phrase, "you're getting older," has become a medical excuse. It's used to disregard signs that would make younger people get checked out right away. This is not scientific medicine. It is practice based on assumptions. To be honest, the figures are rather scary. Research conducted by the American Geriatric Society indicates that 85% of major health concerns in older persons are first attributed to aging prior to receiving an accurate diagnosis. Heart troubles show up as weariness that comes with becoming older. Thyroid problems cause people to lose energy all the time. People who have trouble with their mental health are told that it's just a normal part of growing older, and people who have cancer are told that it's just their body becoming worse. Think about Carl, a 67-year-old retired construction foreman. He told his primary care doctor that his joints were becoming stiffer and he was getting more tired over the course of 8 months. Every visit brought the same response: "Carl, you're not 30 anymore. Your system is becoming worse." When Carl finally pushed for lab testing, doctors learned that he had significant rheumatoid arthritis that had been damaging his joints permanently for months. The gaslighting happens in very regular patterns. Doctors use phrases like, "at your stage, that's typical," or "everyone declines," to keep conversations from getting too deep into the symptoms. They'll offer general solutions like getting more exercise, getting better sleep, and managing stress, but they won't go into why these issues came up so suddenly. Women face twofold discrimination, with their problems being rejected as both age-related and hormone-driven. Men's worries about their personal health or emotional changes are often dismissed as normal signs of aging in men. When it comes to mental health difficulties, things are more dangerous since grief and anxiety are blamed on changes in life phases instead of being looked at as physical problems. The worst part is that this gaslighting makes older people doubt their own memories. When doctors keep saying that frightening symptoms are normal, you start to question what you think. This ambiguity makes people put off going to the doctor, which is honestly worse. This is your strategy for protection. Always respond to age-based dismissals with thorough questions. If a doctor says, "that's normal for your age," you should inquire, "what percentage of people my age have this exact symptom? What study substantiates that this level of symptoms is typical?" Most physicians can't provide evidence since they are making guesses instead of doing clinical tests. Make symptom records that demonstrate rapid changes instead than steady declines. Instead of saying, "I've been feeling more tired lately," provide facts. "My energy stayed the same until March 15th, when I needed to relax in the afternoon for the first time." This turns your anxiety from a complaint about getting older into a condition that comes on suddenly. Ask for clear diagnostic criteria. What tests would you ask for if I were 40 and had the same symptoms? This makes them explain why different care requirements are based just on age. A lot of the time, they'll realize they have age bias and ask for thorough testing. Use the technique of concern progression. Say clearly, "Doctor, I know that getting older affects energy, but this is a big change from how I usually feel. I'm worried that this may be an indication of a hidden ailment. What tests can we do to rule out medical reasons before linking this to getting older?" Bring someone with you when you go. When someone else sees someone being rude, physicians change how they respond. Your supporter may ask you more questions that you might not think of and help you keep track of the conversation. This is something really worrying that needs to be looked into. Instead of giving real medical care, healthcare practitioners often give people drugs to help them control their behavior. The most disturbing thing about elder care is that these medicines are used to regulate behavior instead of treating serious medical problems. Doctors often prescribe elderly people psychiatric meds, tranquilizers, and behavioral drugs. This doesn't happen because of any real mental health condition. It occurs because these drugs make patients more willing to follow rules in hospitals and nursing homes. This alarming practice has come to light thanks to Dr. James Martinez, a former medical director at nursing homes who now speaks out for patients. He says, "I've seen a lot of times when medications were administered not to improve the health of the patient, but to make things easier for the personnel. Seniors who were worried got tranquilizers. Patients who were vocal got behavioral drugs, and those who wanted answers got antidepressants. It's healthcare that hides chemical control." The stats are rather scary. Over 40% of older people use at least one psychiatric prescription, while only 12% of them genuinely have mental health problems that need medication. The other prescriptions seem to be more for convenience than for medical reasons. These drugs sometimes have substantial side effects, including as injuries from falling, mental deterioration, and greater mortality rates. Think about what happened to Beverly, who was 69 years old and used to be a teacher. After her hip surgery, she became tired of waiting for her recovery to speed up and started asking specific questions about how long it would take. The medical staff called her a problem and gave her anxiety pills to calm her down, but the medicines made her feel confused and unstable, which led to a fall that broke her wrist. Her first injury healed, but problems with her medicine made her recuperation last 4 months longer. Meds for behavior modification go well beyond only psychiatric meds. Doctors often give seniors sleep drugs for normal changes in sleep that come with age, not for real sleep disorders. Providers often don't provide older individuals with true pain treatment because they think they are looking for medicines or exaggerating their agony to obtain attention. Many seniors are prescribed blood pressure medicines that make them feel dizzy and tired, which makes them less inclined to keep active or speak out during medical appointments. When patients complain about these symptoms, physicians usually say they are just part of the therapy and don't change it or think about other options. The most concerning aspect is that these drugs might induce the same problems they purport to mitigate. Tranquilizers could make you confused, which might be mistaken for dementia. People who use behavioral medicines might become apathetic, which is commonly mistaken for depression. Sleep medicines may disrupt normal sleep patterns, leading to genuine sleep disorders that need further pharmacological intervention. Healthcare facilities often advocate for this method since patients on medication need less staff time and oversight. Insurance companies support it since mental medicines are cheaper than full medical exams or therapy. Families may ask for it because they have a hard time dealing with how their loved ones really feel about their health problems. Knowing what each medicine is for is the first step in protecting yourself. Say, "I need clear goals for this medicine. I want to discontinue it and try other things if there aren't any specific improvements within a certain time frame." This stops people from using psychiatric drugs for an indeterminate period of time. Ask independent pharmacists or aged care experts to look at your prescriptions and find ones that aren't needed, combinations that are hazardous, and ways to cut down on pills. A lot of older people discover that the medications they take don't really help them. Before you start taking psychiatric drugs, write down what you can do mentally and physically. Do full cognitive testing, balancing tests, and emotional exams. This beginning point helps you find changes induced by medicine and gives you evidence if you need to ask for it to be stopped. If your prescriptions change how you think or how aggressive you are, build a support system that can speak out for you. Choose someone who will question your medical decisions and make sure your concerns are heard, especially if psychiatric meds modify your personality or mental ability. The most heartbreaking thing about senior healthcare is how doctors decide what treatments to give you based on how much they think your life is worth. Private medical consultations show how doctors balance treatment costs against quality-adjusted life years, often resulting in older adults receiving substandard care based on age-related cost rather than clinical needs. This distressing fact is revealed by ethics professor Patricia Chen, who studies healthcare distribution. Quality-adjusted life years in medical education value lives financially. A 70-year-old's future is valued less than a 40-year-old's, affecting organ distribution and cancer therapy. Institutional age prejudice disguised as healthcare economics. This evaluation framework harms treatment decisions. Healthcare providers sometimes deny older patients expensive operations, novel therapies, and intense interventions since their longevity doesn't warrant the expense. Similar surgeries for younger people become too dangerous or expensive for seniors with similar health issues. Consider 68-year-old retired engineer Walter. Medical professionals promptly advised comfort care and warned dialysis would be inappropriate given his age after his renal failure diagnosis. Walter fought for 3 months to get life-saving therapy like younger people. He resumed regular activities and lived 7 more healthy years after starting dialysis, which he would have lost by embracing age-discriminatory medical advice. This prejudice negatively affects diagnostic testing. Seniors sometimes reject costly scans, specialist exams, and preventive screenings based on statistical forecasts rather than medical needs. Age is often considered in approval processes by healthcare professionals and insurance companies, assuming older persons won't live long enough to be detected or prevented. Mental health care is significantly limited by age. Seniors' despair and anxiety are typically discounted as aging reactions instead of getting the same treatment as younger people. Mental health medicines, counseling, and psychiatric therapy are shockingly wasteful for persons with limited remaining years. Seniors making discriminating evaluations increases the issue. After repeated lowered care recommendations, many elderly persons think their lives are worth less. They stop seeking complete treatment, accept substandard care, and base their end-of-life decisions on social devaluation rather than survival interests. The most evident prejudice is in emergency departments. Seniors with similar symptoms are seen briefly, tested less, and discharged quicker. Emergency doctors privately admit that elderly patients get fewer comprehensive examinations. Financial concerns are particularly difficult during family discussions. Medical staff gently encourage families to choose cheaper care for older relatives by portraying constraints as comfort-focused or age-appropriate. Families are encouraged to consider treatment burdens without knowing all possibilities. Your value is consistent regardless of age, demanding self-advocacy. Ask, would you suggest identical treatment for a 45-year-old patient? When suggestions disagree, ask for medical rather than economic reasons. This method forces physicians to justify age-based treatment bias. Compare therapy success rates for your diagnosis among individuals your age. Many seniors overcome age-related stereotypes with excellent therapy outcomes. Present this study at medical visits and demand all appropriate treatments without cost. Geriatric medicine professionals who understand senior treatment outcomes might provide new medical viewpoints. General doctors' palliative care recommendations work for many illnesses when administered by age-specialized specialists. Get legal help as needed. Federal laws prohibit healthcare age discrimination, and senior rights lawyers may help get rejected treatments. Record instances when age seems to affect treatment recommendation. Contact elder advocacy organizations for healthcare prejudice, help, and resources. These groups acknowledge systemic biases and may help with appeals and alternative therapy. Your right to refuse age-appropriate care limits. Regardless of age, you may demand equitable access to vigorous interventions, extensive testing, and novel therapies. Life meaning isn't determined by actuarial formulae. You now know the 5 painful truths about medical ageism that healthcare workers wanted to keep secret. But here's the big news. Knowledge is power. You've gotten the tools you need to turn every doctor's appointment from a quiet receiver to your own advocate. Think about Walter, who fought for access to dialysis and had 7 valuable years that doctors sought to deny him. Think about Beverly, who overcame problems with her medicine and became well. These tales aren't just a few exceptional cases. This arises when older people refuse to accept unjust treatment that is only based on their age. Every time you challenge age-related assumptions, demand equitable treatment, or ask for comprehensive care, you're doing more than just helping yourself. You're changing the way our whole medical system treats older people. Your bravery makes waves that aid all the old people who come after you. Healthcare facilities like it when elders don't say anything and tolerate bad treatment without complaining. But you've changed. You see the bias, understand how unfair it is, and have ways to fight back. Don't let age-related prejudice get in the way of your health, self-respect, and future years. Start changing the way you get healthcare right now. You deserve medical care that is based on your own health needs, not on what others think about your age group. If this film showed you how unfairly you've been treated in healthcare, please like it and share it with every senior who needs better treatment. Your experience might save the life of another older person. Please leave a comment. Have you ever been a victim of medical ageism? What will be different about your next appointment? Let's all work together to have equitable healthcare. Sign up and turn on alerts right now. Every senior deserves respect, dignity, and important medical care without being discriminated against because of their age. Together, we're changing healthcare for good. Please like, subscribe, and keep fighting for the respect we've earned. Which of these habits inspired you the most? Leave a comment and let's grow stronger together.